They say, show me a woman without shame, and I'll show you a man. Welcome to Shameless Parenting. Welcome back.
Hi, good to be back.
Welcome to Shameless Parenting.
Yes.
Well, you'll notice that we're not in our studio,
Yes, we are not.
and there's a reason for that. A lot has happened in the last week, but Rose is sleeping in the studio at the moment, and that's because of a strange and peculiar smell that started to kind of emanate from the kids' bedroom. We were scratching our brains trying to find out what it was. It was like I suppose, how would you describe it? A fishy kind of musty smell.
Musty smell. Obviously, your first thought is have the kids weed somewhere. So we're checking everything, we're washing everything, taking everything out of the room. Can't figure it out, but you were onto it. You kind of thought you...
Oh, it was like a bloodhound. I was like sniffing everything, you know. It's like the thing that all parents do where they go, oh, has the baby pooed? And you don't just kind of sniff in the general direction like a single person. You jam your nose as like far up that nappy as you can to see if you can smell it.
Is it a fart or is it a poo?
The eternal
Hard
question.
to tell.
Anyway, long story short, I was going insane and looking up Google searches around what creates this fishy, slightly urine-y smell. And it was really alarming because it comes back with it's typical of melting or overheating electrical wires and can result in electrical fire. So I was like sniffing the PowerPoints like a madman, taking all the light fittings off. Finally, yesterday, we went into the manhole, and it's crazy up there. You know, I've actually never been into the manhole at our parents' house. And I finally got right to the top of the ladder, very vulnerable, half expecting something to come and attack me. And I spotted the biggest brush-tailed possum that has died in the attic on top of the bed of the kids' bedroom. So we have a visitor that is decomposing up there. We can't reach it. We've called the possum man to come tomorrow. And frankly, it's just very gross. I dreamt of that possum last night, that it would somehow come back to life and crawl through the manhole, of which I'm sleeping underneath at the moment on a couch, and just claw my face off while I slept.
Yeah. And let's be honest, it's not what we needed this week.
Yeah. Well, let's give a little bit of an update of what happened this week.
Yes.
Because the last time we spoke, we actually had, like we often do, Rory attached to you, and he was snuffling, and we were apologizing to the listeners of all the noise.
Yes. So as everyone's probably aware, Rose has been sick. Of course, poor Rory, being the youngest, is catching everything at the moment. But on Saturday afternoon last week, Ryan noticed him starting to wheeze, and also we could see that he was starting to really suck in air like around his rib cage and so forth, which is a big kind of telltale sign that your baby is working harder than they probably should be to breathe, and was a trigger for us to take him to emergency. Luckily, we acted quickly. We took him to emergency, which they said was the right thing to do, and he was admitted into the hospital, and we ended up spending 3 nights there. So basically, very quickly, he was swabbed, and he had contracted RSV. Don't ask me what it stands for. We will probably put it in the post-production stuff that you do, but it's a basically respiratory, something that starts with S and then probably V for virus. And he had to go on high flow oxygen. So our poor little baby has spent a number of days in hospital on high flow oxygen, a feeding tube down him. Basically, there is nothing that they can give to treat the virus. It's all about helping his body fight it. And so we thought that it would be a really good topic for us to focus on today, because I think we've learned a lot going through this process. We've learned a lot about RSV. We've learned a lot about, taking your baby to hospital, things that we now would, tips that I think would be great to pass on to other potential parents and so forth as well. So I think it would be a really it's going to be a really interesting discussion that we're going to have today on that.
Yeah, definitely. And it's, again, a bit of a public service announcement. We're no stranger to kids and illnesses and a few hospital visits in the night, which are always stressful. But this was something else. It was very specific. And I think that absolutely you can be brought up to speed so that you're a lot more prepared for when scary things happen to your young child in the hospital.
Yeah.
So I want to go through a little bit about that to help everyone understand. We'll do a bit of a best and worst hospital edition, unfortunately. You have to work with what you have. But before that, I think that we will do a listener question just to kind of keep things a little bit lighter, and then we'll go into the serious stuff, which can be a little bit more depressing, but very important.
And obviously you can tell we're back home now. He's doing really well. He was such a trooper, and he's just continuing to recover from the virus at home. So he just has a bit of a bad cough that we might hear every now and then on the recording.
All right. This is a really interesting one that we've found, and thank you for everyone. Please subscribe, share. It really means a lot to us. But more importantly, keep sending in the questions because they're hilarious. So this one actually addresses us personally. Hi, Ryan and Steph. I'm struggling with a delicate situation and could really use some advice. I'm white and my husband is Chinese. Oof, another one for us. We love each other deeply, but I'm finding it increasingly difficult to navigate the cultural differences, especially with my mother-in-law. She's very traditional and tends to overstep boundaries that I'm used to, like coming over unannounced with groceries, taking over the kitchen, and being overall fairly judgmental. While I appreciate her help, she often feels like she's undermining my role in my own home and not respecting my need for privacy.
And Rose has just woken up.
And that's Rose.
So we're going to pause recording for now. And we'll come right back to you when we can.
Where's that mother-in-law when you need it?
Yeah, I know.
Okay. All right, we're back.
We're back.
And as you can see, it's actually dark now, so that's how long it took to get back in action.
I almost thought you were going to do the impossible and rock her back to sleep and get her resettled in her cot, but it did not happen.
I thought so too. She was almost there, but then that last minute put down, they always just spring back to life.
Yeah.
All right, let's go back to the question. And now this is even tougher to answer because you are living with your Asian mother-in-law.
Who currently is looking after our baby so we can record.
Reactions?
Okay, I feel like you were trying to set me up here, but it's not going to work. Because I love my in-laws. Otherwise I wouldn't be able to live with them.
They don't listen to the pod.
Okay. Yeah, but they could be listening right now. I think that absolutely, it's a tough one, right? And I don't know if putting like the race and stuff aside, I think this is something that anyone could relate to because I think it's just a well-known thing that grandparents come over and they're going to, say things that might come across like they're judgmental or be providing advice or doing things that they think is helpful that maybe might not be what you need, etc. at the time and so forth. I think that this happens all the time for people, both potentially with their parents, but especially kind of with their in-laws. And I think that you just have to remember that in most cases people are not meaning for it to come across that way, and are generally, obviously this is definitely the case same with my in-laws, and I feel like it's the case from the story that's come in, they're trying to do the right thing, and that's what you need to sort of remember is put yourself in their shoes. They are trying to do what they probably think is right, and what comes across maybe as meddling is actually they're trying to be helpful because at the end of the day they have gone through this before and they probably feel like they have some kind of wisdom to pass on, whether that wisdom is outdated or not.
Very good answer. And this wasn't to set you up, by the way, like the other question.
Yeah.
So first of all, I want to acknowledge and put raise a glass for this interracial couple. I feel that this configuration of white woman, Chinese man is something that needs to be celebrated. It's it's something that I think is becoming more and more prevalent, but I want to say that it's definitely not usually the configuration that you see, right? Mm-hmm. It's usually a Western man and an Asian woman.
Yes.
And so I just want to take a second of silence to acknowledge this brother is doing the Lord's work. Because I think that in terms of the interracial thing, and other interracial couples will know this, that I feel that because the dynamic is rare, that the man is actually Asian, there are all these stereotypes that they're working against in terms of masculinity, this kind of idea of the Asian nerd kind of thing. Even I'll dob your own mother in, where I think when she first found out you were dating a Chinese man, she kind of what did she do? She was at some food court and she's like, does he look like
that?
Does he look like that? And it was some heinous Asian nerd with glasses and things like that.
Yeah, this is true. Eddie, what do you want me to say from here? Don't make this about race. Get back to the babies, please.
The question I made it about race, and because we are interracial.
Yes.
Look, it's a real thing. I think that you're right that all races struggle with it, and I think it's this attitude towards proprietary and independence. So how independent should you be as a person, as a family, as a parent? And there are cultural differences when it comes to that. I was just having a talk with one of my Indian colleagues, and they spoke about a similar thing, a similar dynamic where they're so involved, their parents are so involved in the household, they often live together, and it's just a very different vibe compared to, the classic Western ideal of flying away from the nest, and then there might be some very controlled visits to the nest from that point on. But things are changing, families are changing, structures are changing. I will say that it is very hard to change the dynamic between a son and ethnic mother. That's something that is quite delicate. And yeah, I've got a lot of sympathy for this woman, because there's probably not really an easy way. A lot of the behaviors that you might find overstepping their bounds or abrasive to you are probably so internalized at this point. They don't even know, your husband and your mother-in-law probably don't even know that they're doing it.
Yes.
Right? It's just the dynamic that has formed over years and years and years.
Yes.
Maybe even generations.
The other thing that I would say is think about maybe how you could use some of this to your advantage and the intent. So on the flip side, you often find that those types of grandparents and in-laws also want to be very hands-on, and they want to be very involved, and absolutely use that to your advantage, because there are a lot of grandparents out there that don't want to be down there changing nappies, helping look after your kids, wiping their noses. They're happy to come in for a few hours and leave again, but to actually get their hands dirty and get in on it like ours is an amazing help as well.
Yeah, Grandpa's like, call me when the boy can play golf.
Yeah, yeah, exactly.
No, we won't dwell on it too long. Interesting question. I think we haven't given a lot of advice. I would just say that when there are delicate situations like this is where you have to lean on your partner, right?
Yes.
You have to lean on them to do it, right? So talk to your husband, get him to talk to, call my mama's boy a few times, get him to handle it. That's probably the best way to do it.
Let's be honest, you are a pretty big mama's boy.
Only the best.
Yeah.
All right. Nice. Let's get back to Rory and our recent episode with RSV.
Yeah.
Yeah, so for those that don't know, it's a particular type of virus. It's circulating, it is seasonal, it's like the flu, and it does change and mutate every year, unfortunately. There's no vaccine as such for young children, although there have been recent developments, I suppose, in years gone by for protecting the elderly or those who are immunocompromised. So it's a fact of life, but unfortunately, when it attacks a child as young as Rory, 6 weeks old, the consequences are quite dire. Yeah. The first thing that we probably want to let our listeners know is the whole thing around breathing. And this is not just RSV, it's any kind of respiratory virus or bacterial infection. When you start to hear a wheeze, yeah, that's something to pay attention to. And it's usually at the back of the breath. There's a kind of whine or a wheeze or a catch. And like you said, lift up their shirt and have a look at their chest. Look at the physical effort that's occurring to breathe, right? And usually they talk about the sucking in of the rib cage, almost like as if you were tensing your abs over and over again, and you can see the outline of the rib cage and the abs working. That's when you need to start thinking about getting some medical attention.
And around the throat as well. If you see sucking in going
Dimpling.
on around the throat, yep, same thing. That's generally a trigger to you probably need to go to hospital.
Yeah, and we're talking about very young children now, newborns and such, in the first 6 months of life. But if you see that, that's regardless of what's happening, that's a indication that you might need to get the oxygen levels checked, because there's laboured breathing, the physicality of breathing is starting to affect the child. So we saw that, we identified the wheeze, we had a look, and yeah, we checked ourselves into hospital.
Yeah, I mean, we turned up at emergency, and because obviously of Rory's age, we got through to the triage nurse pretty quickly. We were seen by a doctor pretty quickly. And yeah, they, after examining him, basically what they did was his oxygen levels were actually reasonably okay, but he was working very, very hard in order to get to those oxygen levels. They counted his breathing, for example, and he was well over kind of 60 breaths per minute, which is very kind of high. So we got basically then admitted into the hospital. Now, there is no cure, nothing that they can give him. All they could do was help him fight, I guess, the virus himself. So really the only options they have with RSV is putting them on oxygen. There's low flow versus high flow. We could talk a bit around the differences of those to help them breathe, and potentially putting them on a drip, etc., if they're having trouble with feeding as well.
Yeah, and I might overlay some of these pictures in the video for reference for everyone. So we're essentially Rory and you were in the hospital, in the ward, and you have to make your way through, I suppose, emergency triage towards the pediatrics unit of your hospital. And that kind of happens over the preceding hours. Oxygen levels are monitored through a sensor that gets strapped to your baby's foot. So that'll be something that's tied in and plugged into the monitors. And they're looking for that level. For us, it was that 90 that we were looking for, but it depends on the monitor. And we will explain at that point that the real concern in a baby this young is that RSV peaks in day 3 or 4.
Yeah.
Yeah, so
Potentially day 5, between 3 to 5.
Between 3 to 5. So really what's happening now is they're trying to do their best to intervene in a way that protects your child against that dip, at the peak of the illness, where interventions are limited due to that age. So we had 2 options in terms of intervention. One was the low flow oxygen, and the other was the more intense high flow. Low flow, or they call it dry oxygen, I think, is essentially a little tube that just sits in the nostrils and tries to, I suppose, feed that oxygen in just through the nostrils with a tiny little tube that's held in place. But there's no forcing of the air through, it's not humidified, and essentially it's just a little boost. So that's what they offered for Rory to begin with.
Yeah, that was kind of like level 1 that we had on the first night. And the idea is they kind of keep putting these interventions, I guess, in, and then they kind of assess how Rory is going, if he's the same or worse, etc. And then they'll start to kind of escalate, okay, if we need to move up to kind of the next level, etc. from there.
Yeah.
So with Rory, he was still, I guess, not improving, which is why we then needed to move up to high flow, which I would actually say the high flow I actually found better and more comfortable for him than the low flow, because the actual, I guess, things that get inserted into his nostrils and connected to his face, etc., were much more comfortable and much more secure. So for a baby of his age, it was actually better. They also need to put essentially a tube down into their stomach as well. And the reason they do that is because they might need to remove air from the stomach, because obviously they're pumping kind of air in, so they need the ability to remove air every now and then. But it also meant that we could move to feeding him that way as well. So up until then, I had actually still been breastfeeding him. I could have continued to breastfeed him even with the high flow on, but it starts to get really complicated with things all over his face and so forth. And I really wanted to start to have a bit more control around and work with the doctors and the nurses on how much is he actually taking in. So we moved to pumping and feeding him in this way, so we could actually control how much he was feeding, because they don't want to overload his stomach with too much food, so that they're not putting pressure on his breathing as well.
Yeah, every little bit counts, I suppose, in the pressure on the child at this point. So I guess calling out here that if you are in this situation with your child, it's very confronting, because it's probably the only time a relatively healthy baby gets this level of intervention, I suppose, from a virus. And I know personally I'm always caught up with trying to avoid medical intervention, but sometimes you do just have to be at the mercy of the process. And they try to tell you that actually it looks really bad with RSV, and when your child has to go onto high flow oxygen and they essentially incubated with these tubes everywhere, but it very much is the best thing for them. It's the way to kind of relieve discomfort, but also to avoid that kind of panic from the child.
Yeah.
So high flow is very confronting. You've got tubes taped down, sticking into both nostrils, and a feeding tube in that essentially can depressurize the stomach and act as a drip. Sorry, not a drip, but a feeding tube. And I remember when I first came in, luckily, fortunately for me, I wasn't there while I was being put in. Yes. Which is awful.
He didn't love it. But once it was in, he was fine.
Yeah, but they're very much hooked up. It's very confronting to see your child that small, but it's all normal.
Yeah, definitely. And the relief that I could see he had once he had that high flow in, it was like he just looked so much better. His body was more relaxed, and he just slept for hours and hours after that, because you could just see he was absolutely exhausted from how hard he had been having to work. Now, we didn't have to go here, but there was, I guess, the following night, I know when I spoke to the nurse, she said, I really didn't know which way he was going to go. But the next intervention from there, which we didn't have to go to, which is basically not feeding at all and moving to being fed through a drip. Basically not really fed, intravenously, basically maintaining your fluids in that way so that his stomach would be empty. That would have been the next stage, which I really didn't want to happen, because it's hard enough to settle a baby that's at 25% full, let alone 0% full. I thought he's just going to get very agitated around that. And then the next step from that would have actually been to be transferred to a children's hospital if he needed to get basically higher levels of oxygen than what they could provide at the hospital. So those would have been the next steps. But we just had to wait and see kind of how he was responding to things, and thankfully that was not where we needed to go. He started to improve after a night of being on that, and we ended up being in hospital for 3 nights in total.
Yeah, and the other thing to mention, I suppose, is that periodically they will have to provide suction to the baby, and for Rory it was no different. They have a thin tube that has suction, and they'll be essentially trying to clean out the mucus, because the child that young can't blow their nose, and they won't anyway because it's full of tubes. That is very traumatic for the child. It's just uncomfortable.
I'm going to stop you there. I'm going to say it's traumatic for us.
Yeah, that's right.
Actually, for the child, obviously they don't like having something stuck up their nose and they're screaming and so forth, but afterwards, when they are clear, they breathe so much better. And as with most of the things we're talking about, I think they're traumatic for us as the adults, but not necessarily the baby and the child themselves. I think things often look and sound worse than they actually are.
They do, yeah. Especially when you have to hold your child's head still or something, which we had to do at various times.
Yes.
And the nurses are very good about that. But yeah, it can be tough. There's nothing worse than hearing the cries of your child, right? And you know that they don't understand. It's like giving them needles or any kind of medicine they don't want, but they need to have. You know, it's very heartbreaking.
Yeah.
Because they don't understand, right? So that's essentially the intervention, and they'll hold them on their high flow oxygen and monitor. And the other complications are really just up to the breastfeeding mother, unfortunately, to try their best to manage your supply, which is thrown into chaos.
Yeah, I mean, so this is sort of one of the things I wanted to touch on, because we have to remember, obviously, the baby is the patient, you are not the patient. And so, you know, very quickly I kind of worked out, this is not like when you're in the maternity ward after you give birth. They are not going to be asking you about your supply, are you pumping, what you want to do. You have to really take control of that yourself and stay on top of that. So as you start to see where things are going, ask them for a pump if you haven't brought your own in. Most hospitals would have one that you can borrow, and start working out what you need to do to maintain that supply. And also staying kind of ahead of what your baby's feeds, etc., kind of need to be as well, because in my experience, that's just not going to be what they're thinking about and not going to be top of mind. And in this kind of situation, they kind of don't care whether we're giving the baby breast milk, are we giving the baby formula, are we feeding them through an IV, etc. That's not the priority at all, but that probably is the priority for you.
Yeah.
And so that's kind of where you really need to sort of take control and make sure you're on top of that and working through what is the feeding and the pumping schedule, etc., that you need to be maintaining your supply. That was definitely something that I was stressing about in the hospital, because I've only been, purely breastfeeding him. And so I was really worried, am I pumping enough, not pumping enough, etc., and trying to make sure I got that right. And I found actually just by pumping every 3 hours-ish, and then a little bit less overnight, because I know in general, Rory generally can go longer overnight without feeds and not as big feeds. So I knew I could kind of, push that out overnight. So tried to kind of mimic what his feeding pattern usually is. That's kind of what worked for me, and I think I did manage to stay pretty much in sync, which was good.
Yeah, that's amazing. Definitely doing things for yourself, not making sure that you understand what you're driving as well. There are just so many people coming in and out of the hospital in terms of nurses and doctors, that you as the parent have to be that consistency, that continuity, right? And I think that you did that so well through such a tough time. So I just want to say that. All right, let's go to best and worst. I know it's a bit of a weird one, but we're going to do best and worst hospital inpatient edition. Maybe I can do the outpatient. Or just even things that you want to call out as things you really hated, things that made you happy.
Well, I guess what my recommendation is going to be when I think about best is kind of what you were touching on, which is, as the parent, you need to be that constant person. And what that means is that when the doctors are coming in and out, when the nurses are coming in and out, you're often getting different, obviously, nurses as shifts are kind of ending and changing. They are looking to you to understand, how is Rory comparing now to how he was 2 hours ago, 12 hours ago, etc. as well. You're kind of actually really providing that guide. So they can obviously assess Rory in terms of how he is right now, but his improvement, etc., or if he's going kind of the other way, is he getting worse? They're actually really looking for you. And so one of the things that I really wanted to recommend that I started doing in the hospital is filming him, because I found very quickly I'm so sleep deprived. I'm already sleep deprived before I even get to the hospital, let alone once I'm there. You're getting even less sleep than you got at home, which you didn't think could even be possible sometimes. So I found that I just couldn't remember. I was like, is this breathing worse? Is it the same? I'm not sure. I don't have confidence. So I actually started filming it so that I had a kind of a reference point. So I was half asleep, everything's dark, I'm not looking, etc. So one of my recommendations is going to be, get the phone out, film, and have a look. So you've got a reference point. One of the things, for example, was Rory's head bobbing. He was bobbing his head because he was struggling, to get that breath in. So we're looking at his head bobbing, then we put the high flow in, and then a few hours later they're asking me, is his head bobbing any better?
Yeah.
I really needed that video as a reference point to go back to understand, because it's really tough to remember. So that was going to be my recommendation in terms of not necessarily best.
And your worst?
Okay, I'm going to go with hospital food. I know it sounds ridiculous to say,
Given you weren't the patient.
given I wasn't the patient. So I think I was lucky to be getting any food at all. So I was going to say that expect that it will be probably quite horrible. That's okay. It's obviously very nutritious, but they don't probably add salt to anything because it's a hospital. So bring your own snacks and bring your own food in. I was very lucky before I headed into emergency. We kind of loaded, you loaded me up with a few snacks and stuff as well, which was great and kind of got me through that first night. But, having you kind of come in and being able to bring, a few things in was really, really good. Obviously, coffee.
Yeah.
Funnily enough, they weren't offering a lot of coffee in the children's ward. So making sure that, you can get
Baby
access to, no baby chinos, no. So having snacks, kind of loading up and all of that stuff. I guess it all comes down to being prepared for when you go to emergency, walking into it thinking you might not actually be leaving in a few hours. And that's something mentally I wasn't totally prepared for. I full on thought we were going to be going to emergency, we'd spend a few hours there and then they'd be like, yep, he's all good, watch out for this and go home.
To be fair, that's usually what happens.
Yeah.
Right. Usually it's more of a cautionary thing, just a peace of mind thing.
Yeah.
And which is why we're going on about it for a whole episode. RSV is one of those things that can happen to any young child. Okay. My best and worst. So my best is actually I think it's just a general comment on the marvel of modern medicine. I think that I was sitting back and watching all the pieces come together, and it really was an amazing moment, right? When you can see the level of expertise, the level of logistics that would have to come together to have all these specific medical parts, a lot of them are single use, and all of the stuff that has to be there in the right time and the people that know how to use them. And this is a service that's given to every single citizen of Australia, right? So that, to me, I've got to take my hats off that the healthcare system and the ability to do this for everyone, every man, woman, child, is something worth calling out, celebrating. It really is amazing. The worst, again, I'm just going to call it out. You had to be that. This was your second Mother's Day, and we had to spend in hospital. So that's going to be my worst. But we got through it, and you did an amazing job.
Yeah, thank you. On the hospital system, I was actually thinking when I was there that nurses, honestly, they're like angels. They are incredible. The things that they do, the way they come in and out of your life. I would have a nurse that would be looking after us and she'd be absolutely incredible. One nurse, for example, was as we got Rory off the feeding tube and back onto bottle feeding, etc., took over for a few feeds so that I could get some sleep, even changed his nappy and so forth for him. And I remember just thinking, nurses are honestly incredible. They are angels. This woman has come into our life, gone above and beyond to help support my baby and support me, who is not the patient, to make sure I'm getting enough sleep and so forth as well. She's finished her shift and left. I've not even had a chance to say goodbye. Don't even know her name in some cases. Sometimes you do. Other cases, especially when it's overnight, you might not. And the way that they care and look after us in that time of need is absolutely incredible. I just think that they are angels. They're amazing.
Yeah, definitely. Well, your mother-in-law is a nurse, so it all makes sense.
Yeah.
For her whole career.
Yeah.
But no, I just want to, we're sharing these details because I think that if we knew how it was all going to go in terms of intervention, would really helped as well. So hopefully that can kind of help and ease your mind that even if these things do happen, it's all, it's all managed very well.
Definitely.
Through the nurses and the doctors. And just to also remember, I think we had this moment where you said, I'm just going to hold Rory that much tighter now. I think it's sometimes these little blips of health really serve as a reminder of, how lucky we are and how we should really feel really grateful for everyone's good health.
Yeah. RSV is around. It's around a lot at the moment. It is apparently a lot
worse than usual, and a lot of that is as a result of, you know, coming out of COVID and lack of, you know, people mingling together, etc. So it's something definitely to look out for. One of the things I often think about in hindsight is Rose was obviously very unwell. Potentially, if we had her tested and had known it was RSV, would that have made us a little bit more prepared for, you know, for Rory? I don't know, but just being aware of the fact that it is so prevalent at the moment, and if you do have young babies, etc., what are those signs to look out for, particularly around respiratory distress and so forth, I think is really important.
There we go. All right, till next time, and we
Thank
hopefully
you.
have a not so serious topic next time, but yeah.
Thank you. Bye.